The term metabolic psychiatric disorder might sound pretty unfamiliar to many of you, but in reality, a lot of what we commonly think of as typical mental health issues, like anxiety, depression, and hallucinations, could actually be linked to a metabolic condition called IEM, inborn errors of metabolism. Today, we're going to talk about one such metabolic disease, CBS deficiency. It's a common genetic metabolic disorder that might not seem related to mental health at first glance, but trust me, it actually has a huge impact on our mental state. Through the real-life stories of two patients, Lena and Tom, we'll dive into how CBS deficiency affects their nervous systems and leads to cognitive, emotional, and even psychiatric symptoms. While CBS deficiency isn't the root cause of all mental health disorders, it definitely opens up a new perspective in understanding mental health issues. Thanks to genetic testing and the study of metabolic genomics, we can catch these metabolic defects early. With proper metabolic treatments and nutritional management, we can help patients improve their quality of life and ease their mental health struggles. CBS deficiency isn't just a family story. It also sheds light on the pathology of metabolic psychiatric disorders. For many parents and patients, recognizing and understanding this condition could be the key step toward solving their mental health challenges. 1. Clinical features of CBS deficiency. CBS deficiency, also known as Classical Homocystinuria, HCU, is a genetic metabolic disorder, IEM. It's caused by mutations in the CBS gene, leading to an amino acid metabolism disorder typically inherited in an autosomal recessive manner. Simply put, this disorder affects multiple systems in the body, leading to a range of symptoms. First, eye symptoms are one of the most typical signs of this disease. Patients may experience lens dislocation, where the lens in the eye shifts out of its normal position. This often appears in childhood and is frequently accompanied by severe nearsightedness, myopia. If not treated promptly, vision can worsen over time. This symptom can sometimes be misdiagnosed as other eye conditions, leading to delays in treatment. Next, let's talk about the skeletal system. Many patients develop a morphinoid body type, which means they're tall with long limbs and their fingers and toes are particularly long. Some may also experience scoliosis, curved spine, or pectus excavatum, sunken chest. Osteoporosis is also common, making bones more fragile, with a higher risk of fractures due to low bone density. For the vascular system, high homocysteine levels increase the risk of blood clotting, particularly in the brain and deep veins, which can lead to strokes. This is a major cause of death in CBS deficiency patients, with many showing signs of clotting events in their teens or adulthood. Now let's talk about the central nervous system. This disease can lead to cognitive impairments, intellectual delays, learning difficulties, and problems with attention. If untreated, especially if the optimal treatment window is missed, irreversible brain damage can occur. However, if caught early and treated, cognitive function can usually be restored, and intellectual disabilities can often be prevented. This is why time is brain. In addition to these, many patients may also experience psychiatric symptoms like anxiety, depression, hallucinations, delusions, and sleep disorders. These symptoms are sometimes mistaken for mental health disorders, causing the underlying metabolic cause to be overlooked. Later on, about 21% of patients may develop seizures, and some may also experience extrapyramidal symptoms, like muscle rigidity. What's really interesting is that CBS deficiency can present with highly variable symptoms. Even with the same genetic mutation, the symptoms can be very different. Some patients may have few or no symptoms, especially those who respond well to vitamin B6 treatment. Others may experience severe multi-system damage. For those who didn't receive timely treatment during childhood, symptoms often only appear in adulthood, particularly clotting events like strokes. In conclusion, CBS deficiency presents in a very complex way, and each patient's condition is different. Understanding these symptoms and getting an early diagnosis is crucial for improving treatment and quality of life for patients. 2. Mechanism of CBS deficiency. The core mechanism of CBS deficiency is actually a disruption in the metabolism of homocysteine. To put it simply, the CBS gene codes for an enzyme called cystathionine beta-synthase, which helps convert homocysteine into cysteine. Cysteine, in turn, plays a key role in the metabolism of methionine, an essential amino acid. When CBS enzyme activity is reduced, homocysteine can't be properly converted and starts to accumulate in the body. Additionally, the production of important sulfur-containing molecules like glutathione is hindered, directly affecting the normal function of the nervous system. This metabolic disruption leads to elevated levels of methionine and homocysteine, while cysteine levels drop significantly. Over time, this imbalance can have a serious negative impact on both the nervous system and overall health. Fortunately, there are ways to help manage the symptoms. Treatment typically focuses on two main approaches. First, metabolic therapy, including supplements of vitamins B6, B12, folic acid, and betaine, which can help restore some CBS enzyme activity. Second, dietary interventions, particularly a low methionine diet. These treatments work by adjusting metabolic processes and can significantly improve the patient's clinical symptoms and related complications. So, with proper treatment and dietary management, people with CBS deficiency can experience a noticeable improvement in their quality of life. 3. Mechanism of neuropsychiatric symptoms in CBS deficiency. The symptoms of CBS deficiency can be incredibly challenging for patients, especially when it comes to the mental health issues it triggers. At the heart of this metabolic disorder is high homocysteine, HHCY levels. This metabolic imbalance not only affects brain function, but can also lead to a range of psychiatric symptoms, including anxiety, depression, cognitive impairments, and even schizophrenia. So, why do these symptoms occur? First, let's talk about neurotoxicity. When homocysteine levels are too high, it disrupts the balance of two important neurotransmitters in the brain, glutamate and GABA. It activates a receptor called the NMDA receptor, which causes a flood of calcium ions to rush into neurons, damaging them. This overactivation, particularly in areas of the brain closely linked to memory and thinking, like the hippocampus and cortex, causes neurodegeneration, leading to cognitive and behavioral abnormalities. Next, we have oxidative stress. High homocysteine promotes the production of free radicals, damaging key cellular components like lipids, proteins, and DNA. What's worse, it depletes important antioxidants like glutathione, making the brain and blood vessels more vulnerable to oxidative damage. This, in turn, triggers neuroinflammation and causes dysfunction in neurons. Additionally, high homocysteine impacts blood vessel function. It can damage the blood vessel walls, promoting clot formation and increasing the risk of stroke and deep vein thrombosis, DVT. These vascular issues also affect the supply of blood and oxygen to the brain, leading to brain ischemia and hypoxia, which ultimately impacts cognitive function. Then there's the issue of methylation and protein modification. High homocysteine interferes with some very critical processes in the body, such as DNA modification, protein function, and the development of neurons. The result? Impaired neurodevelopment, poor myelin repair, and disrupted neural network function. All of these issues accumulate over time and eventually lead to neurodegenerative damage. Neurons lose their function and eventually die, speeding up cognitive decline, memory loss, and emotional issues. In severe cases, this can lead to symptoms like depression or schizophrenia. What's more, CBS deficiency shares a lot of similarities with genetic metabolic brain diseases, GMBDS. The mechanism behind GMBDS usually involves gene mutations or enzyme deficiencies that cause an accumulation or reduction of metabolic products, leading to damage to nerve cells, demyelination, and neurotransmitter abnormalities. CBS deficiency works through a similar mechanism, causing homocysteine to accumulate and disrupting brain metabolism, which leads to cognitive impairment, emotional issues, and a variety of psychiatric symptoms. It also affects vascular health, increasing the risk of blood clots, which further worsens neural function. So, early detection and intervention are critical to improving the patient's quality of life. 4. Real patient case reports. 1. From bone issues to mental health challenges. The story of Lena and Lucy, two sisters, shows us the profound impact that CBS deficiency, Classical Homocystinuria, can have on mental health. Lena is a 29-year-old woman who has had scoliosis and pectus excavatum since childhood. At 12, she began receiving medical evaluations. Initially, doctors suspected she had Marfan syndrome, but no genetic testing was done. It wasn't until she was 26, with symptoms like mitral valve prolapse, that she sought further medical attention. Though the genetic tests didn't confirm Marfan syndrome, her health issues continued to worsen over time. At 27, Lena had a severe mental health crisis after the loss of a loved one. She experienced extreme mood swings, confusion, and even hallucinations, delusions, and thoughts of suicide. She was urgently admitted to the psychiatric ward, where she was treated for 17 days and diagnosed with a brief psychotic disorder. Though a low dose of olanzapine helped her symptoms somewhat, her anxiety and depression remained. This mental health crisis led doctors to conduct genetic testing, which revealed that Lena had CBS deficiency. The high homocysteine levels she had for a long time were at the root of her health problems. Even though her cognitive reasoning remained normal, doctors found her scores in areas like mood, memory, and executive function were significantly lower, all closely linked to her metabolic imbalance. After starting treatment, Lena's homocysteine levels dropped, but her anxiety didn't improve immediately. Because her diagnosis came late and the long period without treatment likely caused significant nerve damage, her prognosis for recovery wasn't optimistic. The damage to her brain function, especially in areas like memory, thinking, and emotions, might have left irreversible marks on her brain and nervous system. In contrast to her sister, Lucy's situation was much better. At 25, Lucy was also diagnosed with CBS deficiency through family genetic testing, but her health issues were mainly related to her neurovascular system. At 17, she developed a dural sinus thrombosis after taking birth control pills and had to undergo anticoagulant treatment. Although Lucy's homocysteine levels were lower than Lena's, she also experienced anxiety and panic attacks. Fortunately, after treatment, her anxiety was effectively managed, and her emotional issues improved significantly. Lucy's prognosis for mental and neurological health was better than Lena's. mainly because her homocysteine levels were lower and she had less long-term damage to her nervous system. Even though the sisters come from the same parents, their health outcomes differ greatly. This could be due to genetic heterogeneity and differences in their diets and nutrition. Their story shows us that even with the same genetic mutation, the disease's expression and prognosis can vary widely. This variation depends on many factors, including metabolic levels, early diagnosis, and timely treatment. Understanding these differences can help us better recognize and manage metabolic mental health conditions like CBS deficiency. 2. A 16-year-old boy's mental health symptoms. Tom's story highlights how a common metabolic disorder can affect mental health. Tom is a 16-year-old boy from Turkey who had a normal childhood. But at 14, he began experiencing what seemed like normal teenage mood swings. At first, he would occasionally talk to himself and seemed anxious and irritable. However, over time, his symptoms worsened. He started having trouble sleeping, lost his appetite, and began wearing multiple layers of clothing, even though it was hot outside because he felt cold all the time. More concerning, he started hearing things. He claimed there were cats and dogs wandering around in his house. He said he heard someone calling his name and at times felt afraid of dying. These symptoms made him increasingly uneasy, and his family began to notice his behavior becoming more and more unusual. Tom's symptoms intensified. He started experiencing hallucinations and delusions. At a family gathering, he suddenly became scared, claiming he saw a sword coming toward him and heard someone threatening him. His family was shocked, as he claimed that the voices he heard weren't from strangers, but from someone saying, "They're going to kill me." Even worse, his cognitive abilities began to decline. At one point, he didn't recognize his own parents and even asked, "Who are you?"
I don't have legs.
He also said his kidneys were failing and that he didn't have legs anymore. These hallucinations and delusions left Tom completely lost in his own world, unable to control himself. As his condition worsened, his family decided to take him to the hospital. Tom was initially diagnosed with psychotic disorder and intellectual disability. Doctors started him on antipsychotic medication, but it didn't help much. In fact, on the third day, he developed nausea and vomiting due to an upper respiratory infection and was rushed to the ICU. After further tests, doctors discovered that Tom's homocysteine levels were abnormally high. He was eventually diagnosed with homocystinuria, HCU. This metabolic disorder causes homocysteine to accumulate in the body, disrupting normal brain neurotransmitter functions and triggering mental health symptoms. Once diagnosed, doctors created a treatment plan for Tom, including medications like vitamin B6, B12, and betaine to help lower his homocysteine levels. While the treatment did lower his homocysteine levels, his mental health symptoms didn't improve immediately, reflecting the long-term and complex nature of the mental damage. After adjusting his treatment plan, Tom's mental state gradually improved. His hallucinations, delusions, and other symptoms started to disappear, and he eventually stabilized. Tom's story shows us that there's a close connection between metabolic disorders and mental health. Timely diagnosis and treatment can effectively help patients manage their symptoms and improve their quality of life. Although homocystinuria is a rare disease, its impact on mental health cannot be ignored. Especially when undiagnosed, it can lead to serious psychological and physical health problems. Conclusion: the neuropsychiatric symptoms of CBS deficiency might seem like common mental health disorders at first, but the underlying cause is actually a metabolic issue that we haven't fully paid enough attention to. If diagnosed and treated early, many patients can avoid further damage to their nervous system and greatly improve their quality of life. Just like Lena's scoliosis and mental symptoms, or Tom's long undiagnosed psychiatric symptoms, these cases remind us of an important fact. Mental health problems aren't just brain-related, they could also be a warning sign of metabolic imbalances. I hope this video serves as a wake-up call for more patients and families, helping the medical community gain a deeper understanding of metabolic mental illnesses and encouraging earlier diagnosis and treatment so more people can recover sooner. If you're interested in stories about genetic metabolic disorders, IEMS, and their connection to mental health, what we call metabolic mental disorders, don't forget to like, subscribe, and share this video with anyone who might need to see it.